About 5,000 Stanford Health Care and Lucille Packard Children's Hospital nurses went on strike Monday morning to demand for hospital officials to reach a new contract, seeking better staffing and mental health support. The strike marks the first for Committee for Recognition of Nursing Achievement, the union that represents nurses at Stanford and Packard, in more than 20 years, and comes after negotiations with Stanford management stalled after the nurses' labor contracts, covering about 5,000 nurses, expired March 31st. Nurses said that Stanford management failed to agree to terms that would inadequately address staff shortages, support patient care, and create sustainable nursing careers. About 93% of eligible nurses authorized the strike, which Krona will use to set up a picket line and hold a 9 a.m. Monday press conference outside Stanford Hospital along Welch Road at Packard Drive, according to a statement from the union. As one of the nation's top healthcare systems, Stanford and Packard have an opportunity to demonstrate leadership and work with nurses to solve the burnout and exhaustion that is driving many of us to reconsider our jobs and our profession. We've been disappointed by hospital administrators' consistent refusal to acknowledge the reality of understaffing, constant requests for overtime, little time for rest with our families, and insufficient support for mental health, said Colleen Borges, president of Krona and a pediatric oncology nurse at Packard Children's Hospital. A strike has always been the last resort for Krona nurses, but we are prepared to stand strong and make sacrifices today for the transformative changes that the nursing profession needs, she said. We hope to get back to work quickly under fair contracts that acknowledge nurses' contributions and support excellent patient care. Stanford and Lucille Packard have scheduled a formal bargaining session Tuesday with its nurses. Krona gave notice of intention to strike April 13th. The union has reiterated its intention of continuing contract negotiations with management. Stanford nurses are joining a growing movement of other U.S. healthcare workers who have bemoaned the lack of staffing, pay, benefits, and quality of life that came to a head during the COVID-19 pandemic. Last week, 8,000 nurses at 18 Sutter Health facilities staged a one-day strike to call for better staffing after working under an expired contract for 10 months. Healthcare strikes have also taken place in New York, Massachusetts, Oregon, Alabama, and Montana. Last November, Kaiser narrowly averted a strike of 50,000 healthcare workers. Nurses at UCLA Medical Center and UCSF Medical Center are planning to hold press conferences and rallies Wednesday to call on the University of California to address staffing shortages and patient safety, according to the California Nurses Association. National Nurses United in a Monday statement. Since the beginning of the COVID-19 pandemic, nurses have been outraged as we have watched our hospitals fail to provide the basic resources to protect us, such as personal protective equipment and adequate RN staffing, said David Yamada, a registered nurse at UCLA. For the past 2 years, management has publicly called us heroes while at the same time failing to adequately address the ongoing needs of the frontline staff and continuously violating our contract protections.